Good afternoon, everyone. Welcome to the Metro Child Fatality Review meeting. Please sign in. Make sure everyone has signed the confidentiality agreement. We just have the one case today. Could we start out with the medical examiner's report?
Sure. The autopsy was basically negative. The child had height and weight appropriate for age. A full skeletal survey was done that showed no evidence of any acute or healing fractures. And if a full autopsy was done as well, which entails first examining the body on the outside of the body and noting any abnormalities there, then opening the body, examining the organs as they lie in place, and then removing each organ and examining it further. The person who did this autopsy also did additional testing for metabolic disorders, genetic disorders, vitreous chemistries, and microbiology, and all of that was negative.
We were dispatched EMS to a pulseless, non-breathing child around 2015. The child was staying with his grandmother, and she had stated that the child was blue and not breathing, and she was attempting CPR when we arrived there. She handed the child to us, and we did CPR all the way to the hospital, and the child was pronounced at the hospital.
When law enforcement arrived, it was about the same time as EMS. The house was cluttered, but it was clean. It was well furnished. There was a bottle that was found next to the bed area. There was a preliminary investigation was attempted, but due to the grandmother's emotional state, they felt better that it not be continued. In addition to that, there was 2 other children that was inside the house that kept interrupting, so that causes some problems. However, the interview was conducted or continued the next day at the grandparents' home. The child was placed on the bed, and there was no crib. Grandmother's babysat about once a week. A reenactment was conducted there, and during the reenactment, it was determined that the child was placed to sleep on an adult type of bed on the back, on his back in a queen size bed specifically with a pacifier. The pillows were placed on each side of the infant to keep the infant from rolling off the bed. It was lightly covered with some sheets. The grandmother found the child face down on a soft pillow. She picked up the child, she started CPR, called 911, and held the baby until EMS arrived. Grandmother was babysitting the child while the parents were at a wedding. I believe that's what it was at a wedding. The parents were interviewed at the hospital, and they stated that the child had a little cold with some nasal discharge. The child's appetite wasn't affected by the cold at all.
There were no GCS history found on the child, but we did receive a neglect death referral, in which was worked by the investigator and presented at the Child Protective Investigative Team, and it was closed and classified as unsubstantiated.
And this was Mom's second baby. She started prenatal care in her second trimester and was enrolled in WIC. The family came to the health department for their immunizations, and everyone was up to date. They also were enrolled in one of the home visiting programs, HUGS.
The district attorney's office had a little minor history on the father. He'd been arrested for disorderly conduct when he was 18. Since that time, he'd only had a speeding ticket. The mother's history was nothing other than a driver's license violation. However, the grandmother did have a prior history for both drug usage and shoplifting about 15 to 20 years ago, but nothing more recent than that.
Looking at the medical files, this mother entered prenatal care at 4 months and made all of her appointments except for one. And then in the last month of the pregnancy, she had weekly visits. There weren't any problems noted during the pregnancy, and there was no history of smoking. All of the well baby visits were kept as they were normally scheduled. Immunizations were up to date. The child had never been seen in our emergency room at all in looking through the record. But when the child was brought to the emergency room, was pulseless and not breathing and could not be revived.
Thank you, everyone. Does anyone have any questions before we move on?
Yeah, I have one. Has the DA's office closed this case?
Not officially. We're still looking at and evaluating the issue of whether or not this child was developmentally capable of rolling over from his back onto the pillow to position himself in the manner in which he was supposedly found. And we're also interested in trying to find out some information about where the other children were at in the home and whether they had any contact with the infant that evening. If anybody has any information regarding that, I'd be welcome to that.
Did you see the bed where the baby was sleeping? Were the pillows still there? Were the blankets still there?
We didn't see where the baby was sleeping. The grandmother met us at the door, and we took the baby from her.
The grandmother indicated that the bed had a blanket and a pillow on it when the child was sleeping.
And does law enforcement know who all lived in the home, and was it overcrowded?
I think only the grandmother lived in the home, and the child lived with his parents. And also there was a 3-year-old brother. Sibling was present at the home. There was also another child, 4-year-old male cousin, I believe that it was. All the children were babysitted by the grandmother while the parents were at this wedding.
The grandmother babysat at least once a week, I think you said earlier. So do you know why she didn't have a pack and play or a crib in her home?
I think that the grandmother thought that it was sufficient since she had done this before, not only with her children, but with other children. So she didn't think that nothing bad would ever happen.
Does WIC educate the parents about safe sleep?
Yes, when they come to pick up to the WIC office, WIC does educate on safe sleep. However, Mom said when she was in the hospital that she observed the nurses putting the baby in the bassinet with a blanket. So she was just modeling the behavior that she saw the nurses do in the hospital. She's enrolled in the Hugs Home Visiting Program, and we provide education on safe sleep recommendations. So she was instructed multiple times. The grandmother says that she was not educated on safe sleep.
The mother said that she had a crib, and because this was a stay-at-home mother, they really didn't ask anymore about what other arrangements might have been made with people who might be keeping a baby. It just didn't come up.
Did this baby have any medical conditions?
No, this was apparently a healthy baby, well cared for, according to the pediatrician's notes. The nasal discharge that the parents talked about had developed since the last visit to the pediatrician, and the APGARs at birth, according to the pediatrician's records, were 9 and 9.
Was the baby breastfed?
The notes reflected that the mother tried but was unsuccessful.
All right, any other questions? Thanks for sharing all this information, clarifying those issues. Before we start talking about prevention issues specific to this case, let's make sure that we're all clear on cause of death and preventability of death. The death certificate, does anyone want to discuss that or have any questions about that?
I think the cause of death was recorded accurately. There were several risk factors for suffocation, and given the unsafe sleep environment that the child had been placed, and also that the child was found deceased face down, it makes perfect sense that the death certificate reads suffocation. All right. Does anyone else have ideas about what we should record for cause of death?
I think there's evidence that this was sleep-related death, and the environment contributed to the death.
All right. Hearing no disagreement, I guess we can move on. Let's talk about prevention for a couple minutes. Does anyone have any ideas on this case about whether this death was preventable?
Well, I would say this death was clearly preventable, as it occurred only because the child was placed in an unsafe sleep environment with soft pillows and adult bedding.
And the parents were educated about safe sleep recommendations multiple times, weren't they?
Well, again, according to the records that the pediatrician provided, it looks like that there were safe sleep procedures gone over at the hospital, through WIC, hugs, and then at their wellness visits. So while some behaviors ensuring safe sleep, like the baby sleeping in a crib, was given, there were also modeled behaviors at the hospital that were somewhat contradictory to that. But regardless of that, the person caring for the baby had never been informed about safe sleep procedures.
So, so I hear a couple of themes here. I mean, one is I thought we were doing better in the hospitals, and we might want to think about modeling behavior in the hospitals. The other is about non-caregivers who are giving care. Do we have recommendations about what prevention efforts or initiatives we could recommend?
Well, we could check with the hospitals about their safe sleep policy and just make sure that they are implementing that. And so that way, parents will model behavior that they're taught about in hospitals.
I think another recommendation would be to target those people who are sometimes caring for these babies, in addition to the parents who that we know are getting the safe sleep message, but not the other caregivers. So I think somehow we need to be targeting messages to them.
This is kind of a recurring theme for us. We're seeing these deaths in, we're reaching the parents, but we're not reaching these other caregivers. Does anyone have ideas how we can go about implementing these recommendations?
I think the state has a current initiative on safe sleep in the hospitals, but we can send out a team and just make sure that it's being followed.
Another idea, I think we could go to senior citizens and distribute some information about safe sleep for caregivers.
That's a good point. What used to be normal isn't normal anymore. If the seniors were accustomed to that being safe sleep, that's not really what's acceptable anymore.
I think another thing that we could at least look at is, given that we've certainly had a number of children die in the last couple of years in unsafe sleeping conditions, that we look at the demographics of each of those cases in terms of who was with that child, and if we're looking at people other than parents who we know are getting the message, is there some other commonality in terms of age, in terms of where they live? Is there any information that we're already capturing in this committee that we can look at, that we can then target for information?
Yes, absolutely, because we have too many of these, and I think looking at them all together, identifying the commonalities, both in this committee but also in fetal infant mortality review, I think we could better target those efforts. Based on what's been proposed so far in terms of the hospitals and seniors, is there anyone who wants to get started with that effort?
I'd be willing to do that.
Okay.
And I can help out as well. We can coordinate so we can contact all the senior centers in the area.
Okay, and we'll look more systematically at the demographics of these caregiver situations and see if we can come up with something that we can refine our prevention efforts on. Any other questions or comments? Hearing none, we have no holdover reviews, so we are done for today. Thank you, everyone, for attending the Child Fatality Review meeting, and we'll see you at the next meeting.